The East, Central and Southern Africa Health Community as a regional intergovernmental organization was established in 1974 to foster regional cooperation in health among the member states. Building capacity and actions to improve the health workforce situation in the region remains one of the critical areas the regional body is paying attention to. With increasing migration of health workers, Africa continues to lose health workers to developed countries in search of greener pastures. This situation has greatly contributed to critical shortage of human resource, critical skills, and competence health specialists, among others. Among the countries critically affected within the East, Central and Southern Africa Health Community include Kenya, Lesotho, Malawi, Tanzania, Uganda, Zambia, and Zimbabwe. These countries have been classified by the World Health Organization as having human resources for health crises. Sub-Saharan Africa as a region carries 24% of the global disease burden, but has only 3% of the world's health workers and less than 1% of the world's financial resources for health. For effective health service delivery, it is widely acknowledged that a minimum density of 2.3 professional health workers is needed for 1,000 population. But for Malawi, as an example, this could be worse.
The World Health Organization recommends to have 20 doctors for every 100,000. But currently, as I'm speaking, we have about 4 doctors to 100,000. You can see that we are far below the required standards.
And we thought the time had come that we should now start engaging in activities that bring us into an active community. Not a community that says you are my brother, but a community that says you are my brother, let us eat together, let us grow together. Let us have shared ambitions. Let us aspire to greatness, but realize that if you walk alone, you get there very fast. But if you walk together, you get very far.
In the spirit of regional cooperation, this situation compelled ex-health community health ministers to prioritize human resources for health as a critical area of focus by establishing institutional mechanisms to respond to this crisis. In partnership with the colleges under the EXA Health Community College of Health Sciences, specifically COSEXA, EXACON, CANEXA, COPEXA, the EXA Health Community Secretariat undertook to implement various activities to respond to the health minister's call.
EXA Health Community, one of our chief mandates is to foster regional cooperation on health and ensure that the best possible standard of health for all our population in all our member countries. And one of the areas we have identified is a shortage of human resources and skills. So the idea is to combine the strengths from various countries. For instance, we come to Tiolo Hospital, we bring specialists in urological surgery, which are in short supply in Malawi. We bring specialists in orthopedic surgery that are in short supply in Malawi, and we combine nursing skills in critical care, theater nursing, and so on. So in that way, by pulling together the resources we have, the human resources we have, and working in partnership with the Ministry of Health here to make available the equipment required, we are able to contribute to Malawi's quest to better the health of the populations.
It is for this reason that the notion of medical and surgical camps was born. The first camp was held in the Kingdom of Lesotho in 2012, and then Kingdom of Swaziland in 2013. The aim of the camp is to bridge the existing knowledge and skills gap within the region and promote South-to-South cooperation.
Medical and surgical camps represent an innovative service modality in the delivery of specialized care to patients by providing free specialized medical and surgical services in district hospitals that have no clinical specialist or regular visiting physician. They target those patients who might otherwise not receive the service due to many reasons. This event will therefore bring together local and foreign specialists, doctors, nurses, as well as other healthcare professionals.
In 2014, Malawi has been privileged to host the third medical and surgical camp held at Cholo District Hospital, more than 400 kilometers south of the capital, Lilongwe. This camp brought together professionals from Exa Health Community College of Health Sciences. These included surgeons in the various specialties, physicians, anesthetists, obstetricians, and gynecologists, specialized critical care nurses, physiotherapists, and other medical personnel who came together to care and treat those in need without cost to the patient.
Ndicho tupa mimba ndipo chima ndikueteka mondi sausa kuti ndigwire ntchito ni malephera kupita umunda ongolima pang'ono mphamvu ndilibe.
Vuto langa ndilosakoza sindikakoza nthawi imene 212 ndinayamba ine kuchokera 212 intilo ule paka 13 paka 14 ntchito pakhomo osagwira bwino iye.
Kutenda ndikudwala ndi wa hip joints akuoneka ngati pali maspoilings kumatuka mafupa ndiye ndakhala ndili vuto limene kuyambira chaka chatha mu February to date.
I'm the president of the College of Anesthesiologists of East Central and Southern Africa. Our services are required in caring for the patients before surgery, during surgery, after surgery, and the critical care, those who are in the ICU. The medical surgical camps were an invention that came as a result of the need that was felt of the population groups that are encompassed in the region of East Central and Southern Africa. It was born of the College of Surgeons for East Central and Southern Africa, who were doing surgical camps every year in each country.
Driven by the theme of bridging the knowledge and skills gaps, as well as promotion of South-to-South collaboration, the camps that have been held so far have proven to support the healthcare backlog in disadvantaged communities.
Myself, I'm working in the section of orthopedics. So mainly I came to understand that those patients who have been suffering for hip and knee problems and suffering for quite long, who mainly the government of Malawi have been trying to get the funds, say to refer them elsewhere abroad or somewhere else for treatment, but it has not been forthcoming because of the shortage of funds.
Furthermore, the camps have brought back hope to those people who almost lost optimism for recovering their good health.
Chiyembekezo yanga nchoti ndilandire mankhwala ndithandizidwe.
Chiyembekezo changa ndikukondwera kwambiri kuti ambuye akalola kuti ndikhale bwino basi.
Tikupempha Mulungu kuti asogolere operation yonseyo kuti tioneze tithandiza bwanji mwina mwacho tikathe kuthandiza mabanja mwenyewe.
To the Malawian people, the camp brought back hope to patients whose health has been in balance after failing to afford referral outside the country.
At the end of it all, we hope to see a group of patients that have had service given to them, who are healing, recovering, and going back to lead the kind of life that disease had stopped them from enjoying.
Medical and surgical camps of this nature also enable local health professionals to interact with international specialists in various areas to improve their clinical and nursing skills. Through this interaction, there is a lot of knowledge and skills transfer and experience sharing that builds the capacity of those that require such specialized skills.
This surgical camp has really been beneficial to me because we have learned new knowledges and techniques, more particularly in doing prostatectomies, because oftentimes our patients do bleed quite a lot after being done the surgery. We have learned a methodology whereby the bleeding could be minimized.
This medical camp, I think it has come at the right time. We are sharing experience, and you find that maybe some of them, it seems that maybe they know something, and you know something. Then when you combine those things, at the end of the day, something is happening to the patients, and the patients, most of them, they are really helped.
The free, specialized and surgical care provided has contributed to the alleviation of the existing disease burden in Malawi. It has also given continuous professional development to local health care workers.
At the end of it all, I want to see young doctors and nurses who are inspired to do postgraduate training and become specialists themselves. I want to see this institution now offering specialist services supported by the local Malawian specialists, government of Malawi, and training within Malawi that allows this institution to have its own specialists giving services forever and ever. You have a beautiful hospital here. Not many countries will ever tell you they have a district hospital with 250 beds. This is unique, this is special.
The camp offered mentoring in basic surgical and clinical management skills to healthcare workers who may be required to provide surgical services at any time.
To produce a doctor, it takes time. And even once you have produced one, they still have to go through the actual experience to become a fully fledged doctor or to go and specialize in a specific field. So I'm glad that we are learning together. The event that has taken place here in Cholo is unique.
I'm happy that I have helped a few of the sick Malawians who needed my surgical skills, and we also have a team of resident doctors from Malawi who have been working together with us, and we are happy that we have been teaching them some skills while we are working together. Not that they don't know completely, but we are just adding what is not there and trying to straighten and improve their skills.
At least we've done open prostates, and I think the knowledge transfer is useful as to what we do during the operation, some steps, and giving some clearance or clarification on some steps during that procedure. And I think most importantly on how to manage the patients post-operatively.
Ndikuthokoza kwambiri, ndikukondwera kwambiri. Ndithu.
when you operate on a patient and you see him has a bright face, loving, your face also become bright, and really become encouraged. It's very encouraging.
These highly specialized camps are not just a benefit in skills transfer alone, but to national economies as well. Because beneficiary countries save a lot of financial and material resources that would have otherwise been spent in foreign referrals.
As a health sector, we know that we have some capacity challenges. There are some conditions that because of maybe lack of capacity and particularly lack of appropriate equipment, we do refer people outside the country to India, South Africa. And this medical camp brings in together in the country several specialists who have come to assist those people who have conditions who would have been sent out of the country at a very high cost.
I would like to encourage that's the government to keep close with the EXA health community so that this can be sustainable and even establish, even in part with the appropriate knowledge with the local staff, and also have the armamentarium in place or infrastructure in place so that such services can be done here on a sustainable basis.
The government of the Republic of Malawi is grateful to the EXA Health Community Secretariat for spearheading this initiative, Kenya Airways for subsidizing travel costs for international specialists to Malawi, Press Trust for supporting local organizations, and the organizing teams that have made this important event a success.
Going around speaking to the patients, they are saying these experts should come to Malawi every year. We will discuss with them. But I think what we should do now is to thank them very much because they have done a very commendable job, and many of our own people will go back to productive life after they leave Cholo Hospital very soon.